3 small changes. That's it. 3. But they are the difference between sex that's fine and sex that your partner thinks about for days afterward. I'm going to give you all 3 right now. If you're watching this, there's a good chance something has shifted in your intimate life. Maybe sex still happens, but it doesn't feel the way it used to. Maybe you feel like you're going through the motions. Maybe your partner seems less satisfied than she once was, and you're not entirely sure what to do about that. Or maybe you've started to notice that getting fully aroused takes longer than it did in your 30s and 40s, and that's quietly started to bother you more than you want to admit. I want you to know something before we go any further. None of that is failure. None of that is your body giving up on you. What you're experiencing is a transition, one that every man goes through. And the men who come out the other side with a deeply satisfying, genuinely connected, intimate life are the ones who were willing to learn something new. That is exactly what we're going to do today. I'm Dr. Ella Parker. I'm a certified men's sex therapist with over a decade of clinical experience. And in that time, I have sat with hundreds of men in their 50s, 60s, and 70s, who came to me convinced that their best sexual years were behind them. They were wrong. And by the end of this video, you are going to understand exactly why. If you are not yet subscribed to this channel, I want you to do that right now. Every week, I bring you research-backed, clinically grounded guidance on men's sexual health. No embarrassment, no judgment, just real information that can genuinely improve your life. Hit that subscribe button and make sure you don't miss a single video. Now, let's talk about foreplay. Why foreplay changes everything after 50. Here is something that most men were never told and that most doctors don't take the time to explain. After the age of 50, foreplay is no longer optional. It is physiologically necessary. I want you to really hear that because it changes the entire conversation. When you were in your 20s and 30s, your body ran on high testosterone and a hair-trigger arousal response. You could go from 0 to fully aroused in under a minute. Physical stimulation was almost instant. The refractory period, the time your body needed to recover after sex, was short. The whole system was, frankly, very easy to operate. But testosterone naturally declines at a rate of about 1 to 2% per year after the age of 30. By the time a man reaches his 50s, his testosterone levels may be significantly lower than they were at his peak. And what that means practically is that the arousal process slows down. The nervous system requires more input, more stimulation, more time, more context to reach the same level of arousal it once reached almost automatically. This is not damage. This is not dysfunction. This is biology. The men who struggle most in their intimate lives after 50 are almost always the ones who are still trying to have sex the way they did at 30, rushing past foreplay, treating it as a box to check rather than the main event, and then wondering why the experience feels flat or why performance feels unreliable. Here is the shift I want you to make today. Foreplay is not something you do for your partner before the real thing begins. After 50, foreplay is the foundation that makes everything else possible. It is the warm-up that your nervous system now requires. And when you do it well, when you understand what it actually involves, it transforms not just your arousal, but your partner's experience, your confidence, and the entire emotional quality of your intimate life. Today, I am going to give you 3 specific foreplay strategies that I use with my clients in clinical practice. Each one is grounded in research. Each one is practical enough to apply tonight. And together, they work in a way that is genuinely greater than the sum of their parts. Let's start with tip number 1. Foreplay tip 1, the psychological ignition. The biggest misconception men carry about foreplay is that it is a physical act. It begins with touch, it involves the body, and it happens in the bedroom immediately before sex. That is the mental model most men are working from, and it is incomplete. Here is what the research actually shows. Arousal begins in the brain, every single time. Physical stimulation without mental readiness produces weak results, especially after 50. But when the mind is already engaged, already anticipating, already in a state of low-level desire, the body responds faster, more fully, and more reliably. This is what I call psychological ignition, and it starts hours before you ever set foot in the bedroom. Dr. Emily Nagoski, one of the leading researchers in human sexual response, introduced a framework called the dual control model. The idea is that the human sexual response system has two components working simultaneously: an accelerator, which responds to sexually relevant stimuli and activates arousal, and a brake, which responds to reasons not to be aroused: stress, distraction, anxiety, unresolved conflict, self-consciousness. Here is what changes with age. After 50, men's brakes become more sensitive. This means that even when the accelerator is engaged, a busy mind, a stressful day, a subtle feeling of disconnection from a partner, or a background hum of performance anxiety can suppress arousal almost completely. The physical wiring is fine, but the psychological interference is too loud. So what does psychological ignition actually look like in practice? It starts with intention. Deciding earlier in the day that tonight is going to be an intimate night and letting your partner know in a way that builds anticipation rather than pressure. A text message in the afternoon, a quiet moment of eye contact at dinner that says something without saying anything, a deliberate touch, a hand on the lower back, a longer than usual kiss before you leave the kitchen that communicates desire without demanding a response. What you are doing here is beginning the arousal arc early. You are giving your nervous system time to warm up. You are building anticipation, which is one of the most powerful arousal drivers the human brain has. And you are creating emotional connection, which is, for men over 50 in long-term relationships, one of the most reliable arousal accelerators that exists. You are also critically quieting the brake. When there is warmth and intentionality in the hours before intimacy, the background noise of stress and disconnection fades. You arrive at the bedroom in a very different state than you would if sex was spontaneous, unplanned, and pressure-filled. There is another layer to psychological ignition that I want to address directly, and that is the issue of performance anxiety. In my clinical practice, this is one of the most common and most damaging factors I see in men over 50. The fear of not performing, of losing an erection, of not being enough becomes its own brake. Men tense up before intimacy even begins. And that tension, that anxious self-monitoring, is neurologically incompatible with arousal. Psychological ignition is the antidote to this. When you have built warmth, connection, and genuine anticipation across the hours before sex, when you arrive at the bedroom feeling desired rather than tested, that performance anxiety has far less room to operate. Your focus shifts from what might go wrong to what is actually happening in front of you. And that shift alone changes the entire experience. So your first tip is this: foreplay begins in your mind, and it begins long before the bedroom. Build anticipation deliberately. Create emotional connection earlier in the day, and give your nervous system time to arrive before your body has to perform. Foreplay tip number 2, the full body slowdown. Once you are in the bedroom, most men go straight for the obvious zones. This is understandable. It is what they have always done, and it is what popular culture has always reinforced. But it is a significant missed opportunity, and here is why. As men age, penile sensitivity gradually decreases. This is a well-documented physiological change. It is not universal, and it is not dramatic for most men, but it is real. What this means practically is that genital stimulation alone becomes less reliably arousing than it once was. The body needs a broader input. More of the nervous system needs to be engaged to build the kind of deep, sustained arousal that support strong erections and satisfying sex. This is exactly what Sensate Focus addresses, and it is one of the most research-validated tools in all of sex therapy. Sensate Focus was developed originally by Masters and Johnson in the 1960s and has been refined and validated by decades of clinical research since. The core principle is simple: non-genital, full-body, non-goal-oriented touch. Touch that is not aimed at producing orgasm, not aimed at leading anywhere specific, and not measured by any particular outcome. Touch that exists purely to create sensation, presence, and physical intimacy. What does this look like in practice? It looks like taking time, real time, at least 15 minutes, to explore each other's bodies without the endpoint of intercourse as the immediate goal. Slow strokes down the spine, deliberate attention to the inner thighs, the back of the neck, the chest, the stomach. Warmth and pressure and variation in touch that covers large areas of the body before it ever approaches the genitals. A 2019 study published in the Archives of Sexual Behavior found that couples who engaged in 15 or more minutes of non-penetrative intimacy before intercourse reported significantly higher arousal, stronger erections in men, and greater overall sexual satisfaction on both sides compared to couples who moved quickly to penetration. 15 minutes, that is the number. And for most men over 50, it is genuinely transformative. Here is the neuroscience behind why this works. Extended full-body touch activates the parasympathetic nervous system, the rest and connect branch of your nervous system, as opposed to the fight or flight branch. Arousal and erection are fundamentally parasympathetic processes. They require a state of relative calm and safety in the body. When you rush, when there is pressure and urgency and a performance mindset, you activate the sympathetic nervous system, which suppresses arousal. Slow touch does the opposite. It literally creates the neurological conditions that erections require. At the same time, extended touch raises oxytocin levels, the bonding hormone, which in turn supports nitric oxide release in the blood vessels. Nitric oxide is the biochemical compound that causes the smooth muscle in the penis to relax and blood to flow in, producing an erection. This is the exact same pathway that erectile medications activate artificially. Extended, deliberate foreplay activates it naturally. I often tell my clients, good foreplay is nature's version of what's in those little blue pills, and it comes with none of the side effects and all of the emotional depth. There are specific areas of the body that are worth paying particular attention to. Erogenous zones that are often overlooked but carry significant nerve density and arousal potential. The inner thighs are profoundly sensitive and sit in close neurological proximity to the genitals. The perineum, the area between the scrotum and the anus, is rich in nerve endings and responds strongly to gentle pressure. The nape of the neck and the scalp respond to light touch in ways that activate the parasympathetic system almost immediately. The lower back, the stomach just below the navel, the inside of the wrists, these are all areas where deliberate, warm attention produces a whole body response. The slowdown is also a signal to your partner. When you take time, when you are not rushing toward a destination, you communicate desire. You communicate that she is worth the time. You communicate presence. And for women, especially women in long-term relationships, feeling genuinely desired and not just physically available is one of the most powerful arousal triggers that exists. The slowdown serves both of you simultaneously. Your second tip is this: slow down, go wide, and stay off the obvious zones for longer than feels comfortable. Your nervous system will thank you. Your arousal will build more fully and more reliably, and your partner will feel something she may not have felt in a very long time. Foreplay tip 3. The communication move. This is the tip that men are most likely to underestimate. And in my clinical experience, it is often the one that creates the most dramatic shift. Here it is, stated simply. Ask one question. During foreplay, at some point, in a warm, unhurried way, turn to your partner and ask, what would feel amazing right now? That is it. That is the move. And I want to explain exactly why it is so powerful. Research from the Gottman Institute, one of the most respected relationship research organizations in the world, has consistently found that couples who verbally communicate their sexual preferences report between 40 and 60% higher sexual satisfaction scores than couples who do not. 40 to 60%. That is not a marginal difference. That is a transformation. But most men over 50 were not raised in a culture that encouraged sexual communication. They were raised in a culture that told them a real man knows what to do, that asking is weakness, that confidence means taking charge, that admitting uncertainty about what your partner wants is somehow shameful. And so they have spent decades guessing, doing what they think should work, hoping for the best, and often feeling quietly frustrated when the response is lukewarm. The one question move dismantles all of that with a single sentence. When you ask, genuinely, warmly, without pressure or agenda, what would feel amazing right now? You do several things simultaneously. You communicate attentiveness. You invite your partner into the experience as a co-creator rather than a passive participant. You remove the guessing game that has silently structured decades of intimate encounters, and you give yourself real information, specific, personal, current information that allows you to actually deliver what she wants rather than what you assume she wants. This matters more after 50 than it ever did before for both of you. Her body has changed too. What felt extraordinary at 35 may feel different now. Hormonal shifts, sensitivity changes, emotional needs, all of these evolve across a woman's life, just as they do across a man's. The woman you are with today is not the same woman you were with 20 years ago. Asking acknowledges that. It says, I see you as you are now, not as you were then. And that is deeply intimate. There is also a performance anxiety dimension to this tip that I want to highlight. One of the quieter but more damaging effects of performance anxiety in men over 50 is that it shifts attention inward toward self-monitoring, toward worry about erection quality, toward mental scorekeeping. This inward focus is the enemy of pleasure and the enemy of arousal. Communication pulls you outward. When you are genuinely focused on your partner, curious about what she is experiencing, attentive to her response, guided by her words, the self-monitoring goes quiet. Your attention is where it belongs, on her, on the moment, on what is actually happening. And ironically, paradoxically, this is exactly the mental state in which your own arousal functions best. Communication during foreplay also creates a feedback loop of confidence. When you ask what she wants and you deliver it, when you see her response, hear her response, feel her body respond to what you are doing, your own arousal deepens. Confidence and arousal are closely linked in the male sexual system. Feeling capable, feeling effective, feeling desired, these are arousal accelerators. Communication creates the conditions for all three. Start with one question, ask it warmly, listen to the answer with full attention, and then respond to what you heard. You do not need a script. You do not need techniques. You just need to be present enough to ask and attentive enough to act on what she tells you. Your third tip is this: speak, ask, listen. Let her answer guide you. It is the simplest move in this video and the one most likely to change everything. Let me show you how these 3 tips work together, because independently, each one is powerful, but together they create something qualitatively different from anything most men over 50 have experienced in their intimate lives. You begin with psychological ignition early in the day with intention and warmth, a message, a look, a deliberate touch that says, Tonight matters, and you matter. By the time you and your partner are in the bedroom, the arousal arc has already begun. The brain is engaged. The brakes are quiet. The body is primed. Then you slow down. You resist the pull toward familiar territory, and you go wide instead. Full body, unhurried, non-goal-oriented touch that activates the parasympathetic nervous system, raises oxytocin, and begins the biochemical cascade that supports strong, sustained arousal. 15 minutes of this real, deliberate, exploratory touch does more for erectile function than almost anything else I can recommend. And somewhere in the middle of that slowdown, you ask, warmly, genuinely, what would feel amazing right now? You pull your partner into the experience as an active participant. You exit your own head and you let her answer direct the next 10 or 15 minutes with a specificity and accuracy that guessing never could. The result is not just better sex. It is a different quality of intimacy altogether. It is the kind of sex that your partner thinks about the next morning and the morning after that, not because of performance metrics or physical fireworks, but because she felt genuinely seen, genuinely desired, and genuinely attended to by a man who was fully present with her. And for you, the arousal is fuller, more reliable, less anxious. The erection, when it comes, is supported by a nervous system that is calm and engaged rather than tense and self-monitoring. The experience has emotional depth rather than just physical urgency, and the confidence you carry out of that bedroom is something that compounds over time, because you have proof, your own lived proof, that you can deliver something extraordinary. This is what foreplay actually is, at its best. Not a preamble, not a box to check, not something you do for her before the real thing begins. It is the real thing. It is the practice that determines the quality of everything that follows. The men who understand this truly understand it, not just intellectually but practically, in their bodies and their relationships, are the men who are having the most satisfying intimate lives of anyone in their age group, not in spite of being over 50, because of what they have learned. I want to leave you with one thing to take away from today. Pick one of these 3 tips and use it this week. Just one. You do not have to do all 3 at once. Start with psychological ignition and set an intentional tone before the evening begins. Or commit to a genuine slowdown and give your full body 15 minutes of unhurried attention. Or simply ask the question, what would feel amazing right now? And see what happens when you actually listen to the answer. Small shifts, applied consistently, produce extraordinary results. That is true in clinical practice, and it is true in life. If this video was useful to you, please subscribe to this channel right now. Every week I bring you honest, research-grounded guidance on men's sexual health, and I want you to have access to every single video. Leave a comment below and let me know which of these 3 tips you are going to try first. And if you know a man in his 50s or beyond who could benefit from this conversation, share this video with him. The information is free. The impact can be significant. I'm Dr. Ella Parker. I'll see you in the next one.